Hello, my name is Anis Ilham Nabila binti Muhammad Isa with the ID number 012023091713. I'm currently doing my second year in cardiovascular technology, and today I'll be talking about the narrow QRS complex, mainly focused in the atrial fibrillation. So I'm going to go through with the pathophysiology and also ECG changes in normal sinus rhythm, and then I'm going to continue it with the atrial fibrillation and then proceed with the examples. So I hope you enjoyed this video. So let's go through the pathophysiology and also the ECG changes. The heart has 4 chambers. So blood that's returning from the body drains from the superior vena cava into the right atrium. The right atrium will then pump blood into the right ventricle, which then will pump blood into the lungs. Blood returning from the lungs will drain into the left atrium, which will then pump blood into the left ventricle. The left ventricle will pump blood out of the heart and into the body. The pumping action of the heart is coordinated by organized electrical activity. Normally, the electrical activity of the heart starts in the sinoatrial node. The sinoatrial node acts as a heart's natural pacemaker, detecting when the heart beats. It's located at the junction between the superior vena cava and the right atrium. The electrical signal starts in the sinoatrial node and then travels through the right and the left atrium, causing the atria to contract, pumping blood into right and left ventricles. The coordinated electrical activity in the atria that causes them to contract is seen as the P wave on an ECG. The atrioventricular node or the AV node is the pathway between the atria and the ventricles. The electrical signal travels through the AV node from the atria down to the ventricles and causes the ventricles to contract. The electrical activity in the ventricles causing them to contract is seen as the QRS complex on an ECG. When the heart is functioning normally, there is a P wave before each QRS complex, and the QRS complexes appear at regular intervals. This is called sinus rhythm. In atrial fibrillation, it occurs when the electrical activity in the atria is disorganized, causing the contraction of the atria to become rapid, uncoordinated, and chaotic. Since there is no coordinated electrical activity in the atria, there is an absence of the P wave on an ECG. The electrical signal that passes through the atrioventricular node to the ventricle is random and often rapid, and this results in irregular ventricular contraction. On an ECG, the QRS complexes are irregular, meaning that the spaces between QRS complexes varies and they occur randomly without a predictable pattern, which you can see on the ECG strip in green color above. Uncoordinated atrial activity means the blood can stagnate in the atria, forming a blood clot or thrombus. A thrombus formed in the left atrium may travel to the brain and block a cerebral artery, causing an ischemic stroke. The risk of stroke is about 5 times higher in patients with atrial fibrillation, depending on individual factors. So let's talk about the common causes. The most common causes of atrial fibrillation can be remembered with the Smith mnemonic. As for sepsis and for mitral valve pathology, such as mitral valve stenosis or regurgitation. I for ischemic heart disease, such as angina or myocardial infarction. T for thyrotoxicosis, meaning excessive thyroid hormones, and H for hypertension or high blood pressure. So there are two lifestyle factors that can cause atrial fibrillation, and these are alcohol and also caffeine. Next, let's talk about presentation. Patients are often asymptomatic, and atrial fibrillation is an incidental finding when checking their pulse. So, atrial fibrillation can be diagnosed after the patient has a stroke. Presenting symptoms can include palpitations, feeling like the heart is beating irregularly, shortness of breath, dizziness, or syncope, which is loss of consciousness, and symptoms of associated conditions. For example, symptoms of stroke, sepsis, or thyrotoxicosis. So the key finding on examination is an irregular pulse. There are two key differential diagnoses for an irregular pulse, and these are atrial fibrillation and also ventricular ectopics. So in ventricular ectopics will disappear when the heart rate gets above a certain threshold. So therefore, a regular heart rate during exercise suggests ventricular ectopics rather than atrial fibrillation. Next, let's talk about confirming the diagnosis. So in a diagnosis, it can be confirmed with an ECG. The key ECG findings to remember are absent P wave, narrow QRS complexes, tachycardia, meaning a fast heart rate with a QRS complex duration of less than 0.12 seconds, and an irregular ventricular rhythm. Next, we'll continue with the examples. So this is the examples that I've chose on the internet for the atrial fibrillation. As you can see, I'm zooming in, and there's absence of P wave, and also the QRS complex is narrowed. So this also determines that the RR interval is irregular, as we can see here. So for the second image, it's the same thing. It's at the long lead 2 down there. We can see there's absence of P wave. So the QRS complexes is narrowed. On this, we see two small box, while previously it's only one small box. So based on this, we can also see that the RR interval is irregular, since it doesn't have the same size. So the next example, the third example that I choose is this one. And as we can see in the long lead 2, it has the absence of P wave, and the QRS complex is narrowed. In this also we have 1.5 small boxes. So this shows that the RR interval is irregular. So if the RR interval is regular with the absence of P wave, it is called junctional rhythm. and since this is irregular, then it is called atrial fibrillation. So guys, how is the video? I hope you enjoy everything and I hope this can help you in gaining some knowledge. So we'll see each other again. Thank you so much for watching and bye!